So I have one question from on behalf of audience. Among so many wellness options available, why should one prioritize flu vaccination for employees?
So I think it's a very good question because the issue is how do you prioritize what you should do as far as various interventions are concerned. And I try to highlight that factor in terms of the benefit that one gets as far as vaccination is concerned. And when we are looking at vaccine preventable diseases, one of the major factors that we're looking at is influenza. It is a disease which spreads rapidly, it causes higher mortality, especially in the elderly and people with comorbidities. And we are finding that a large number of individuals in India who are part of the workforce have significant comorbidities, whether it be related to diabetes. India is known as the diabetic capital of the world, whether it be related to heart disease, hypertension. Therefore, if you want to have a healthy workforce, preventing influenza becomes more and more important. So it is something which should be prioritized. Yes, it doesn't mean that others are not important. A complete wellness package needs to be there. But I think vaccination is a very important part in that whole wellness package.
So I have one more question. How does flu vaccination help in cost saving for an employer? I think you have already shared.
I've shown the slide on that as far as that question is concerned.
Since we are talking about vaccination before the train of vaccination goes, I just would like to ask a small question from Dr. Shriniket. I've heard that recently that you did the vaccination in your company. I just would like to know the experience because a lot of benefits has been shared to me, and I just would like to know the real experience of.
We have been doing regular influenza vaccination to our employees. Every year we provide them free of cost influenza vaccination. And last 3 years I have seen the results that previously our employees used to get in influenza vaccination, this swine flu infection, and many employees got admitted in ICU. There were huge bills also, and there were some life-threatening situations also. But luckily they survived. So when we started this influenza vaccination in the last 3 years, I have seen that in the last 2 years, there are no cases of swine flu influenza infection in my company. So this is the benefit I have seen. I will also share some data. So infectious diseases like influenza in working adults is among the top 3 insurance claim. And we have seen in my organization also. Most important, flu vaccination help reducing complication, increase productivity, and reduce absenteeism. These are the benefits of the vaccination. And also, flu vaccination reduces the risk of heart attacks, as explained by Dr. Guleria, by almost 45% compared to other wellness changes like healthy lifestyle, smoking cessation, which reduce risk by only 40%. So our experience is that this helps in the employee wellness and also helps in the productivity of the organization.
So my question to you,
investment, not a cost.
Sure. So Dr. Guleria, fantastic inputs and insights, and I think all of us know that we are so proud of the fact that you've been a Padma Shri recipient and all the good work that you're doing. A big round of applause for him and amazing work that you've been doing. We spoke about in the context of future of work, how do we build a resilient organizations. We know that there's a big threat when you spoke about that India is the diabetic capital of the country, and we have so much of research saying that India is going to have a potential productivity loss of employees in the range of age 35 to 64 years, which is going to be the highest in the world by 2030. It will be 940% of that of US, and that's a huge threat we are talking about because of a lot of the risks that is involved. So what is your suggestion to organizations to be ready, future ready? How do you build resilient organizations? What is it that they can do to create a health and well-being culture?
So I think it's very important, and it's important for us to realize that as far as our country is concerned, the burden of disease has shifted dramatically to non-communicable diseases. There was a very nice paper in Lancet published a few years ago which was entitled Countries Within a Country, which looked at how different states behave as different country and how we have evolved from 1990 to 2016, as far as the burden of disease is concerned, the initial burden of disease that we had in our own country was related to maternal mortality, infant mortality, infections, causing and malnutrition, a large number of infectious diseases. But the current burden of disease is almost 60% of the burden of disease in our country as far as health is concerned are non-communicable diseases: diabetes, hypertension, stroke, coronary artery disease, chronic respiratory diseases, cancers, chronic kidney diseases. All of these are lifestyle-related diseases, and these are preventable diseases. So although we push for vaccination as one area, we also have to look at lifestyle as far as our current population is concerned, whether it be physical activity, whether it be diet, whether it be the sugar intake, the salt intake, or the degree of activity that we've started doing, or the type of food that we're eating, or the younger generation is eating. I think it's very, very important. We are having a huge problem of obesity which will come up in the next few years. So when we talk of a lot of these diseases, physical activity and making your workforce become conscious about preventive health, I think is very, very important. We look at a lot of curative health, but for workforce to be active, there has to be a lot of push for preventive health, including vaccination, good lifestyle, regular exercise, and making sure that your employees stay fit rather than doing a lot of desk job and becoming obese over time.
So we will take any other questions from the audience. We'll move.
Hi.
To the, yes.
Sir, good afternoon. My name is Amitash Gupta and I'm from Avyukt Healthcare. My question is from COVID vaccinations standpoint. There are a lot of news right now in the media and social media that they claim that, or there's a rumor that the cardiac arrests are happening because of the vaccination. So what's your view or what's your opinion in that area, sir?
So I think we must understand, first of all, that obviously no intervention is going to be 100% safe. So there would be some side effects. We had these issues of vaccination or even other treatment. Even if you look at any intervention, medical or others wise in terms of procedures, all of them do have a complication. But I would say that as far as vaccination is concerned and COVID vaccine, there's been a very robust AAFI platform, acute adverse effect monitoring platform from the vaccination point of view, not only at the WHO level, but at a global level. And the side effects have been there. If you remember, vaccination was stopped for some time by the European Union because of high incidence of blood clotting, which was felt to be there. Myocarditis is another issue which has come up with the mRNA vaccine. But the percentage of people having these problems is much smaller than the benefit that the vaccine is able to achieve. So I don't think the data is strong enough to say that vaccines are harmful. But like any other intervention, I would also say that there are no side effects at all. But the side effects are very minimal and are within the acceptable range.